Hi, I am Dr. Apurva Sharma. I am a consultant neurologist at Manipal Hospital, Palam Vihar, Gurugram. So today we are going to talk about Alzheimer's disease, the early spots and signs which as family we should not miss. Alzheimer's disease is one of the most common cause of dementia. By dementia, we mean there should be a significant decline in one of the core six cognitive domains. The most important one relevant to Alzheimer's is deficit in new learning and memory. Now, the other domains are not unimportant, but for the discussion of Alzheimer's, we'll focus our attention only on this specific domain of new learning and memory. Now, we routinely encounter many activities which require us to rewire, revisit, and recall all the previous informations as well as build our concepts, and maybe that will help us in new learning as well. So imagine going through a new mall and you are visiting a store and one of your favorite stores, and the next time you revisit the same mall, the same space, you tend to recall that I did have a visit last week or maybe last month. In case the patient forgets such subtle past histories, then you should definitely take a consideration of early onset memory disease or dementia. Alzheimer's is a progressive degenerative condition where the brain, specifically certain parts of the brain which are concerned with new learning memory, that is the hippocampus and the temporal gyri, that are known to shrink and disappear faster than the aging. There is no cure for the treatment, or there's no cure for the disease, but the most successful we are today is we can provide some antibodies that might slow the disease progression and the speed. Certain factors which the families must take into consideration is any new change in behavior. So whenever a patient will have a change in or decline in the memory, they will tend to avoid activities or tend to avoid the situations where they will witness such deficits, or they will have the worsening of memory, or they might feel a little ashamed of themselves because they are not able to recall certain specific details. This often can cloud their judgment. They can often show anger issues over such circumstances. Later on, they develop florid signs of memory loss, such as difficulty in keeping accounts, difficulty in managing personal hygiene. They are unable to prepare meals or unable to take care of a loved one. So these are the subtle early signs we should not miss, and I request every family member to be vigilant of these signs and to contact the neurologist as fast as possible. Thank you.